Here is our next video in this series on ACL rehabilitation, following an athlete from surgery all the way back onto the field. It is now post-op week 14 of Maddie's progression, and she's in town for a couple days, so she stops into the clinic so we can see how she's been doing. Remember, now we want to work on progressing to sprinting, pivoting, cutting, jumping, and progressing her functional activities. Now, along with a traditional warm-up that we do, we also want to start incorporating some ball work into her warm-up. This is just another excuse for us to have the ball at her feet, have Maddie get some touches and get more comfortable with this aspect of soccer. Now here you see her doing a simple figure 8 drill. It can be done in a clinic environment or on her own on the field somewhere. And just remember, when they're doing these, the small turns are actually more difficult to do than the larger turns. The whole point of this is to get her moving and get the muscles warmed up, ready for activity. Here you see her doing some form running, pulling a sled, doing some high knees and arm swings. We also have her doing this as a back pedal, working on quick steps, driving the heels and keeping her butt low. Another way to incorporate ball work into her warm-up is we have her knock the ball forward a few yards and then have to accelerate to catch up with it and control it before she goes on to the next repetition. We also have her do some light jogging as part of a warm-up, and then we gradually bring in an aspect of acceleration where she'll jog for 5 yards, accelerate for 10 yards, and then jog again for another 5 to 10 yards. Do that for a few repetitions, and then increase the rate that she accelerates and have her go for a little longer duration. In this repetition here, you can see her accelerate. She'll be sprinting for about 10 to 15 yards, and then have about 10 yards again to slow down. Now this stresses her anaerobic system, which is a little different than the aerobic system she's been using, where she's been doing sort of the low intensity, long duration cardio. So you can see after a few repetitions, she actually needs a little time for some recovery before she goes on to the next repetition. You can see here now she's going to accelerate again, about 15 to almost 20 yards before she starts slowing down. Now we can also incorporate this into an oval type drill where she accelerates for about 20 yards, and then decelerates as she rounds the corner, and then accelerates down the backstretch. If you want to think about her NASCAR analogy, she's going to come from the left-hand side of your screen, accelerate as she goes down, and then decelerate as she comes to the end and then rounds the corner. Now with this, it can be not only a functional drill for her, but you can also incorporate this into an interval training program, again, to start working a little bit more of the anaerobic system that she will have to use when she goes back to playing soccer. Now, as we think specifics of her sport, they say the average soccer player runs about 7 miles during a game, so they have to have a cardio base of the aerobic system, but also work the anaerobic system for the sprint and acceleration, deceleration that she needs. Now you can see this here again as she knocks the ball forward and has to accelerate, and the acceleration phase really puts more of an eccentric load on her quads, and we need to have a good strength base so that that stress doesn't get placed onto her knee joint. Now you can see in this pursuit drill, you'll see me either kick or throw the ball. She may not know the direction that it's coming from because it's coming from behind her, so she'll have to adjust her body, her speed, and her reactions to where the ball is going so that she's able to control it and send it back. This type of reaction drill, again, is just another level of functional activity that we can put into her progression. We continue to have her work on different variations of volleys, doing thigh volley, foot volley, using the laces, using the instep, and then you'll soon see that she'll also incorporate a chest trap into the volley. Now these are drills that she's going to be very familiar with, as they're commonly done as part of their warm-up prior to a game. By having her work on activities that she's familiar with, not only will this integrate some muscle memory from things she's done thousands of times before, but it also helps build some confidence and gets her ready to prepare for the transition to doing some field work, which would be in the next phase of her progression. Now we have to remember that it's important that the athletes working on their own strengthening program, their cardio conditioning, and their flexibility on the days they're not in the clinic. As phase 3 comes to the end, remember our next step is to get her out on the field, and in phase 4 progress to more soccer activities once she's been cleared by Dr. Schwartzberg.